Dr. Fehrman, you mentioned at one point in another section in another video that as people have what you call a bad bite, an out-of-aligned mouth where the hinges, also called TMJ, don't make me pronounce the whole word, I cannot do that, is the whole thing is out of alignment, and of course you mentioned that means you grind your teeth in the wrong way. By doing so you get cavities. By doing so you obviously need crowns and bridges and implants, blah blah blah. But you also mentioned something which struck me, and that is headaches, tensions in the neck, in the lower shoulder, and all those things. So let me ask you this: if a person, and you said that an orthodontist is kind of like, that's one of the main things he looks at. Sure, the cosmetic look is super important, but usually it goes hand in hand. Also, if the cosmetic look is way off, then your alignment is way off, because obviously your teeth are already not aligned. But that rather than just making them good looking, they need to be also fitting perfectly with the rest of the facial structure. And so could it be that a person who, let's say, has headaches, shoulder pain, doesn't quite know where it comes from? He tried a couple of chiropractor, he used 16 different pillows already, and still wakes up with all kinds of tensions, has a few more headaches than he thinks, and nothing seems to be helping. Would it be wise for him to go to an orthodontist, even though he might not have really crooked teeth? He might be just fine. Would it be wise for him to go to an orthodontist and check the bite, and then maybe some small arrangements, some small alignments with those wires could do the magic trick? Not has to, but could do. Would it be a good thing to try that step?
Right. Well, I think that would be a very logical thing to do.
Well, it's not logical to most of us, but it's logical to you.
Yeah, to me it is. But I guess certainly we know that the way the teeth fit can affect things like the way that the lower jaw hangs with muscles, and it affects this hinge joint in the anterior part of your ears, and there's a disc in there, and it's all very complicated. But we know that it can happen. We know that sometimes very minor adjustments make a huge difference in a patient's quality of life, because suddenly the pain is gone, and it's not always pain. Sometimes it's just a stiffness or a sort of a tightness that's felt in there, and those things are often easily treated. Now, it doesn't always work, but that's the human body. But typically the bite can be changed, and you typically get some relief of all these symptoms.
Well, basically, it doesn't always work. So if a person comes to you, you might go and say, no, look, your bite is fine. You've got to keep looking for where your headaches might come from, but at least one part got eliminated. Or you say, yep, there's a good chance this is it. Your mouth is out of alignment. Let's align it. Right? I mean, it's kind of one of those two things.
Yes, but there is a third category also where the bite could look very nice, but the patient has some sort of a habit, like clenching their teeth all night, or maybe grinding their teeth under stress. Well, I don't care how perfect your bite is, you will have problems if you do that enough. So I think it's good to be evaluated. Like you said, at least the bite is one piece of the pie that can cause these problems. So it's a relatively simple thing to check into, and doesn't require tons of lab tests and things that some of the other medical tests would require. But get it evaluated.
Right. And if it is, let's just say, the grinding of the teeth or something, is that also something you would then notice and able to at least make recommendations and or fix with mouth guards or whatever it may be?
Right. Typically, you can see evidence of that on the teeth if you look closely enough. So if a patient's a grinder, you usually can find that out by just looking at the teeth and listening to their symptoms. And there's a whole bunch of different things that can be done about it. But if the bite is causing you to clench and grind, well, then changing the bite is the correct thing to do about it. And you can wear an appliance when you're asleep. and grind on that instead, but that doesn't really fix the problem, So there are things that can be done. It's relatively easy treatment, so it doesn't always work, but it does usually help.
Okay. Well, it's at least worth checking into it, is what you're saying.
Yes, I'd say so.
Well, all right. Thanks again. Thank you very much.
You're welcome.